Varicose vein disease is caused by pressure. And varicose vein disease is just that. It's a disease, just like high blood pressure or diabetes. And for people who have hypertension, you don't give them a handful of medicine and say, take this and you'll be cured. Varicose vein disease is much the same way. It's a genetic disease caused by a weakness in the collagen underlying the valves in the veins. There are valves inside the veins that should open and close between heartbeats to allow the blood to go back to the heart in a stepwise fashion. If you're one of the millions of Americans who have varicose vein disease, then those valves don't work properly, and over time the valves get destroyed. So that when you stand or sit for any long period, the blood more or less pools in the legs and stretches the veins out and causes the veins to ache, burn, sting. In the late stages, you may get skin discoloration or have masses of smaller veins that pop up. It can even lead to ulcers, which are places in the skin where the tissue becomes necrotic. That can all be very easily and safely evaluated. And if you have varicose vein disease, it can be safely treated. The first step is to do an ultrasound. This will be done in the standing position on a platform with the technologist running a probe very painlessly up and down your leg to make sound pictures of those valves. When we identify which parts of the veins, if any, aren't working properly, then the next step is to decide which treatment is best for you. For smaller veins, often injection is enough. We inject a medicine called Sotradecol into the veins. It's the only FDA-approved sclerosant for vein treatment on the market in the United States at this time. Saline is not FDA-approved and never has been. It's not effective for smaller veins and it hurts a lot. Sotradecol is practically painless and very, very safe. For larger veins or veins that have broken valves, then the treatment of choice is endovenous laser treatment or endovenous ablation. This is a very simple procedure. It's done here in our office. The patient's awake. It's all done under local anesthesia and only takes about 45 minutes. The patient can immediately get up, put on a compression stocking, go for a 30-minute walk, and then resume normal activities. The procedure is very easy and very safe. An IV is started in the leg, in the lower part of the leg where the vein bulges the most. Through the IV, an IV tube is passed, and through this tube, a laser fiber is passed. We then go back and numb up around the vein using ultrasound to see exactly where we are in real time. We then laser the vein shut and actually melt it from the inside. The patient doesn't feel any of this except for the initial numbing that takes about 3 seconds. After the procedure is complete, only about 3% of people will ever have to have the procedure again. 97% of people are cured for life. So if you have trouble with bulging, painful veins, no matter how big the veins are, then certainly at least come in for an evaluation to see what it would take to get rid of your symptoms.